Hello, this is Brian Farabaugh, and today I'll be performing a head-to-toe assessment on a 10-year-old patient with asthma. This is Jonah, my patient. Hello, Jonah. My name is Brian. I'm going to be your nurse today. Nice to meet you. I'm going to just wash my hands in the sink over here. Okay, I'm going to put my gloves on now. Mr. Jonah, can you tell me your full name?
Jonah Charles Farabaugh.
And what is your date of birth?
May 23rd, 2006.
That is correct. I have the correct patient. Are you allergic to any medicine, Jonah?
No.
Excellent. What I'm going to be doing is performing a head-to-toe assessment on you today. So I'm just going to ask you some simple questions and ask you to do some things as I check you out from head to toe. Sound good? All right, let's begin. The first thing that I'm going to do is I'm going to assess Jonah's skin color. His skin appears to be pink and the turgor is dry. His temperature on his skin is normal. It's warm and dry on his legs and his arms as well. Open your mouth for me. His mucous membranes are moist and he has no oxygen or any other tubes at this time. He has a saline lock inserted, but does not currently have any IV fluids running. Just a couple of questions for you, Jonah. Can you tell me where you're at today?
The hospital.
And who is the president right now?
Barack Obama.
And what is the month and the year?
The month is November and the year is 2016.
Excellent. My patient is alert and oriented, and now I am going to assess his cranial nerves by checking a few different things out. Jonah, what I want you to do is keep your head straight and follow my finger with just your eyes. Excellent. I'm going to be shining a light in your eyes and I'm going to look at your pupils. Close your eyes for me. Excellent. The next thing I'm going to do is ask you to turn your head to the left. Good. Now turn your head to the right. Good. Now turn your head straight this way. And what I want you to do is look right at my nose and tell me how many fingers you see.
Two. One. One.
Excellent. Jonah's cranial nerves are all intact, his vision is intact, and his pupils are equal and reactive to light accordingly. They are 3 millimeters and react equally. His smile is symmetrical and there is no asymmetry in his face. Just a couple of other things I want you to do to assess your other cranial nerves. Shrug your shoulders for me. Excellent. And down. Stick your tongue out. Good job. And Jonah's 11th and 12th cranial nerves are also intact, as indicated. The next thing I'm going to do is I'm going to assess Jonah's cardiovascular status. First, I'm going to palpate his carotid arteries and his pulses. He has good carotid pulses. Next, I'm checking his brachial pulses. Excellent. And now his radial pulses. And all of his pulses are 3+ on both sides. And I'm assessing his capillary refill at this time, which is normal on the right upper extremity And the capillary refill is 1 second on both sides, which is normal. As I indicated earlier, Jonah's temperature in his upper extremities and lower extremities is warm and dry, and his skin turgor is normal. Next, I'm going to assess his lower extremities. I will assess his femoral pulses, and his popliteal pulses, his post-tibial pulses, and his pedal pulses. Next, I will assess his capillary refill in each of his toes. Jonah's capillary refill is less than 3 seconds in both extremities. There is no edema noted in either the lower or upper extremities. The next thing I will do to assess his cardiovascular status is simulate listening to his heart. Jonah has normal heart sounds, S1 and S2 detected, and there is no murmur or rubs noted. The next thing I will do is assess Jonah's heart rate and blood pressure with my simulated equipment. Jonah's blood pressure is 112/58, which is within normal limits for his age. Jonah's pulse is 88 beats per minute and regular. To complete his vital signs, I will now assess Jonah's temperature under his tongue. Beep. Jonah's temperature is 97.9 orally, which is normal. I will now place a pulse oximeter on his finger to assess his oxygen level. His oxygen level is 99% on room air, which is normal. Do you have any pain at this time? Good. His vital signs are complete and within normal range for his age. The next thing I will assess is Jonah's musculoskeletal system and the continuation of his neurological status. I'm going to ask you to grab my fingers and squeeze with each hand. Jonah's grips are equal and strong on each side. Next, I'm going to have you hold your arm up like this for me, Jonah. I want you to pull back towards you. Pull back hard. Good. Excellent. Now push towards me. Excellent. And your other arm? Pull back towards me and push back. Excellent. His strength and grips are equal in both upper extremities. With your lower extremities, Jonah, I want you to hold this leg up in the air for me. Excellent. Now push down with your leg. Good. Now push up. Excellent. The same with this leg. Push down and push up. Excellent. Now with your foot, push against my hand. Good. Now pull back against my hand. Excellent. And your left leg, push down and pull back. Excellent, Jonah. Jonah's lower extremities are equal in strength, and there is no abnormal findings with his musculoskeletal system. Next, I will assess Jonah's respiratory rate. Jonah has a history of asthma, and this will be especially important to assess the rate and depth of his breathing at this time. I will use my stethoscope to listen to his lung sounds. Just take a deep breath in and out. Excellent. Again. Good. Again. Good. Again. Good. Again. Good. Again. And now I will listen to Jonah's lungs from his back. Please sit up. Take a deep breath. And out. In and out. In and out. In and out. Excellent. Lay back. Jonah has mild expiratory wheezes in all lobes. Next, I will assess Jonah's gastrointestinal status. Jonah, I'm going to ask you to just scoot forward a little bit. We're going to lay you down flat. Excellent. Lay back. What I'm going to do is listen to your belly sounds, and then I'm going to push around on your belly a little bit and ask you some questions. I am assessing from left to right on the lower quadrants. And now I'm listening to the left upper quadrant and the right upper quadrant, following the order of the colon. Jonah's bowel sounds are normal. Next, I'm going to lightly palpate your abdomen. Does it hurt anywhere? I'm being careful to not press more than 1 centimeter in light palpation. Next, I'm going to palpate your organs to detect any abnormalities. And tell me if you have any pain anywhere. Jonah's liver feels of normal size, as does his spleen. Next, I will assess his kidneys on the left and on the right. I detect no abnormalities in Jonah's GI system. Jonah, what we've done today is checked you out from head to toe. You can go ahead and sit up here. And as I've explained to your parents, the reason we did this is to help you, and I want to give you some instructions to help with your asthma in the future. Are you continuing to use your inhaler at home when you need it?
Yes.
Excellent. Just remember to use 2 puffs every 4 hours as needed, but some things that you can do to help cut down on recurrence of your asthma. Make sure that you use good hand washing techniques and wash your hands for 15 seconds with soap and water before and after any contact with certain things, like at school, when you go to the bathroom, whenever you cough and sneeze, cover your nose. And be careful around, especially this time of year, to not, when you're around sick people, wear the masks that we've given you to help to cut down on infection. And those are certain things that you can do to help prevent recurrence of your asthma in the future. How does that sound, Jonah?
Good.
Excellent. Well, that concludes our head to toe assessment and helping Jonah with some prevention strategies for his asthma. Thank you, everybody, and have a great day. Thank you, Jonah.